Okay, what the hell's going on here? Yeah, let's fix this. Okay, I should be starting my live here shortly. For anybody that's on TikTok or Discord, we send a message in the Discord chat to let people know that I'm going live. Let's see here. Where's it at? There it is. Live now. Let's see here. Copy link. Going live in there. Plus on TikTok. Discuss shock. There we go. Okay, let's wait a few more minutes for people to pop in, and then we'll get rolling. So if anybody has any questions right now, you can ask. It's up to you. I don't mind. Excuse me.
So I'm on my third week of EMT school,
Okay.
and we were going over on Monday. One of our lecturers was going through anatomy and physiology,
Ooh,
which I
fun.
think was like chapter 6.
Okay.
I spoke to my professor about it. I've been having trouble like understanding and getting like retaining the knowledge from reading the book, and um, he told me to like just keep trying to like read it and try to teach it to somebody.
Okay.
I take notes on the lectures, but I don't know, like, yeah.
Okay, Dan Lumber 14th edition. That's one I was teaching out of for about 2.5 years with the Army. So chapter 6 is anatomy and physiology. Chapter 7 is pathophysiology.
Yeah.
So chapter 6 is just a lot of just memorization and making connections. If you can give me a few examples of what you're struggling with per se, like I can help you out with that.
So, like, today, as I was, like, trying to read through it carefully,
Hmm.
like, I was able to memorize uh, most of the bones, at least from what the chapter was showing. That, like,
Okay.
trying to remember the little things.
Okay. I got an easy one for you. Do you have like a window pane?
Okay.
In the top left box from your view, write GL.
GL. Okay.
GL. And P as in Sierra Papa.
Okay.
And then on the bottom right, you can write I, but the patient's upper right is the gallbladder and pancreas, kind of. Let's see here. Hold on. And the bottom left is intestines. What the hell?
Yeah.
My live is restricted because it contains unoriginal or reproduced content. This is my own content I created. Screw off TikTok.
Oh, wow.
I created this slide myself. Okay, so yeah, glass
Maybe
PI.
somebody flagged you or something.
So make sure it's always the patient's anatomical position, not your view of it. Some trauma medicine, and they were talking about needle decompression. On their view of the right, so the patient's left, and it's like right side's still not rising. I'm like, what? I'm like, is that the right side? They're like, what's up? So it's kind of funny. What's up? What's up? So make sure y'all behave. All the prayers you can get. I'm just kidding, chaps. To memorize the abdominal organs in the order. So,
And when you say
well, anatomical position, that's where the patient or you is standing straight up, arms down your side, palms forward or anterior.
and a good way to I guess remember uh, even though I should have, but
Get your posterior over here if you ever grew up and your parents were mean to you.
got it.
Yeah,
And like superior and inferior, that's just up and down, correct?
correct. Inferior is below, superior is above.
Okay.
And Chaplin, I have not seen the pit yet. I hear about it. I may watch it soon. I don't know yet. Let's see here. So yeah, superior is above, inferior is down below. So it's usually talking about relationships of different body parts. So the head is superior to the neck, but the neck is inferior to the head. But the neck is also superior to the knees. So,
Mm, okay.
yeah,
I guess that's where it gets tricky for me.
it's you have to look at the full question and figure out what it's asking. If it's
Uh-huh.
asking you, hey, what is the knee? It's a kneecap. Well, what is it? What is it? Would you name it inferior, superior? Is like, well, what's it in relation to? If it's
Uh-huh.
talking about relationships, you have to read the full question to understand what it's saying.
Got it.
Yes, sir. Let's see here. Let me drink some water real quick. Chaplain, I heard good things about the show as a medical professional. A lot of my what the hell's going on with my camera? Camera's freaking out. A lot of my folks that have seen it really enjoy the show. Let's see here. Let me see if I can turn off the background on this camera so it's not being weird. Settings. Where's my settings? Come on, freaking load. There we go. And effects, backgrounds, blur. Let's try that one. There we go. Okay. So yeah, relationships between body parts is a bit.
2, 3, 5, 6, 7, 8, and
Okay.
then 13 and 21.
Okay, those are good chapters to go over. Uh, do you know the difference between ligaments and tendons?
Uh, tendons is what from bone to bone.
Correct. A funny little saying to help memorize that: "Liga liga bone bone."
Like a
It's
bone. Okay.
oh yeah, it's something weird I've learned many years ago, and it stuck with me, and it works. Liga liga bone bone. Yeah, the bone.
And as far as bone goes, the two bones on the upper lip, is it maxilla or
Maxillary.
maxillary?
Yes,
Okay.
and mandibular is the bottom or the mandible.
Okay.
Yeah, different maxilla, you can say.
Uh-huh.
So the maxilla arch or the maxillary arch, it just depends on who's pronouncing it, pretty much. Both mean the same
Uh,
thing, pretty much. Don't overcomplicate some shit. Some people like to overcomplicate it and say, "Oh, I was active duty for 11 years, been reserves going on 3. Taught the Army EMS program for a bit. Now I'm teaching the Navy corpsmen, so they're medical personnel. Teaching is my passion. That's what I'm very energetic about. Things I enjoy. So I like to have fun with this. What the heck was that? My dog is at my door. Give me 1 second. Was at my office door. Okay, so shock management and recognition, as well as get rid of waste. Okay, so your body needs to get the good nutrients and get rid of the waste. So it's an exchange. As blood and nutrients pump to the body's like, hey, I don't need. So let's see here. Cellular impact. Cells become deprived of aerobic means with oxygen. The prefix an or a means it's such a short exchange. We just say lactic acid. That's why whenever you work out and you're doing heavy lifting, push-ups, weightlifting, etc., you need to breathe. People like to hold their breath when they work out because they're like, I'm gonna get that pump. No, you're depriving your muscles of oxygen, which in turn will cause a buildup of, you guessed it, if it's not corrected and recognized quickly, it can lead to widespread organ dysfunction. Function means it's working normally, without normal function, and death. It can be death of the body or death of the organ/organ system. Shock is goes for Discord or TikTok. Ooh, where's my neck? Fantastic. Let's see here. Uh, it's in the name. Failure of any one of these can cause shock. And what about when they're bleeding out? They have no blood volume. They're dying of a shock. Sometimes rapidly, sometimes very slowly. So there are four main categories of shock that we look at. We'll talk about these all just in a second, okay? But you have the pump, which is the actual heart. The heart needs a pump. Failure of this could be caused by a heart attack or a myocardial. Okay, it can be right-sided or left-sided or total heart failure. We can go more into this on another lesson if you like. I can talk about the heart all dang day because I love talking about the cardiac stuff. This is really hard to treat pre-hospital. Another issue you can have is volume. It's usually referring to blood volume, but it can also mean fluids in general. So hypo means low, volume, lemic. So caused by low fluid volume. If it's talking about bleeding itself, means the patient is bleeding out. That is hemorrhagic nature of the blood loss. Okay, so hemorrhagic means you lost blood. You can also be dehydrated, or fourth category. So that's where something is blocking blood flow. Caused by is a physical blockage. Tension pneumothorax occurs when one of the lungs has collapsed and pressure has built up in the chest cavity transversely, which means across. Let's say my right lung here is deflated. There's either open or closed cavity, and then it puts too much pressure on my heart as well as my inferior and superior vena cava, which crushes it pretty much. You might have an open or closed chest wall injury. With tension, it's built up enough where it's causing the pressure on the heart. You may get something along the lines of JVD, jugular vein distension. Your jugular is your neck veins, and the veins are returning blood from the brain to the heart. And if pressure is being squeezed around the heart, it's restricting blood flow, so it's going to cause a traffic jam of blood. You're going to get blood building up right here in your neck. It's going to be bulging. There's a JVD and different things on there. Embolism first. Pulmonary embolism. Embolism is a blood clot that has moved. Okay, a thrombus is a stationary blood clot in its point of origin, and an embolism is a blood clot that moved from somewhere that have restricted movement of the legs and lower bodies. They get something called DVT, deep vein thrombosis. These are it's the only artery in the body that has no oxygen in it, or deoxygenated blood. And as the vessel goes to the lungs, it becomes smaller, and that's where it gets stuck, called a pulmonary embolism. And that can cause obstructive shock. Okay, and then the third type of obstructive shock or thing that can cause obstructive shock is cardiac tamponade. That's a word I was thinking of. Cardiac tamponade. So around most of your organs in your body, you have like a nice little sac that surrounds it to kind of lubricate, protect it, kind of keep it where it needs to be. Your heart is no different. Pericardium is the thing that surrounds the heart there. What is up, Z? It's going to fill with blood. And that could put pressure on the heart and not allow the heart not to fill or not to pump properly. Cardiac tamponade. And that is a form of obstructive shock, anaphylaxis, and neurogenic, or as Anakin says, sand. He hates sand. SAND. And then the volume hypovolemic problems, such as blood and or dehydration, so hemorrhagic or just regular hypovolemic shock. Volemia is hemorrhagic shock because you absolutely lost blood. I love you guys. Uh, Another term you may see with hypovolemic is relative hypovolemia. Yes, I can repeat what I said about the SAND acronym. Let me finish with this one school thought. You're relatively dehydrated. I don't know how to say some things. So neurogenic and D, distributive. Septic, anaphylactic, neurogenic are all forms of distributive shock. Okay. Is that good there, Tina? Just waiting. Boop, 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 boop. For my TikTok folks, how's the sound quality coming through? I can't hear myself, so I'm assuming it's okay. No one's corrected me yet for an echo. Good? Cool. Thank you, Miriam. Okay. Good, good, good. Thank you. Let's see here. Any questions on the perfusion triangle, the pump, the pipe, or the fluid? Give y'all a second to think about that. Type up any questions you may have before I go to the next slide. Okay, moving on to the next slide. What the heck? Mechanisms to keep itself working properly. Your heart's gonna beat faster, tacky. Mechanisms to keep itself working properly. Your heart's gonna beat faster, tacky, fast, cardia, heart, fast heart, pale, cool, clammy skin, maybe, anxiety, increased breathing rate. And as soon as you're done with the run, your body still is compensating. It's working harder. It's compensating well. Okay, it's that's it. It's compensating. It's you may see things increase in value on the numbers. And I'll show you more slides about that later. Decompensated. The body cannot meet demand anymore. Okay, your body does not have the fuel, such as oxygen, H2O, or glucose, to keep up with the demands of its increased state of working. So now it's going to start deteriorating or dropping. Okay. One of the late signs you'll see is a late sign is low BP or dropping blood pressure. This is a late sign, as it says up here. Do not R on your wrist, the radial side. And if you can't see me on my camera, give me a thumbs up. And the thumb side is radial because that's rad. Okay, radial is rad. Thumb side, radial, rad. Hey. Okay. So if you cannot feel one of the weak or one of the dorsalis pedis or on top of the foot, that's a good indicator that they're in shock because the blood pressure has dropped so much that you can't even feel that anymore. Tension, organ failure, and cardiac arrest eventually. Okay, usually as an EMT, you'll probably as an EMT. What is up, doc? Let's see here. So compensated, decompensated, and irreversible shock and uh, maybe, but I'll chat with you offline about that, Jackie. Let's see here. Any questions on the stages of shock? Compensated, decompensated, and irreversible shock / death. Death, death, death. Okay, next slide is going to be general signs and symptoms. Most patients will exhibit the altered mental status. For any type of is little anxiety. That anxiety is an altered mental status. Try and keep blood at the core, at the brain, heart, lungs, the vital organs that you need to breathe and function. Everything else is shutting down. You may see tachycardia, such as a rapid, weak pulse. Another term for weak pulse you may see is thready. Thready, Thready. Thready means weak. Tachypnea, rapid, shallow breathing. Tachy, fast, pnea, breathing. And hypotension. And then you also may get nausea, vomiting, increased thirst because questions so far? Any questions so far from the peanut gallery, my friends? You may see, okay, low fluid volume such as hemorrhagic with trauma, dehydration, and burns, pale, cool, and clammy, or diaphoretic, rapid, weak pulse, so rapid and thready pulse. Throughout. Another thing you might see is cardiogenic. That's the pump problem we talked about before, heart attack versus and heart failure. Probably gonna have chest pain. Might have some. The reason those occur is because the heart is failing to pump. JVD typically occurs with right-sided heart failure, right side, rest of body. So you may have some JVD or some pedal. If blood can't get into the right side of the heart effectively, it's going to back up into the neck veins and into usually where gravity, sacral edema, swelling, dependent edema, because it's dependent on the body position. So remember JVD, pedal edema, lungs, like there's fluid in the lungs because there practically is left-sided heart failure. If blood cannot get in or out of the left side of the heart effectively, it's going to back up into the lungs, left side lungs, left side lungs. Edema is because fluid and blood is backing up into the lung. Let's see here. That's for cardiogenic. For distributed shock, you have septic, which is a widespread, severe infection. It usually starts off as a local infection that's not treated properly or not recognized, and then it becomes systemic or across the whole body, and that is sepsis. And then it becomes septic shock. You may have a fever or hypothermia, high or low temperature. So it's either 98.6 98.6 is normal. It's lower than 96.8. So flip the two last numbers, 96.8. If it's lower than that, that can be considered a warning sign for hypothermia for septic. Skin may be initially warm and flushed because it is an infection. Pre-hospitally, as an EMT, it's really hard to manage this because as an EMT, per registry standards, you cannot give IV vaso vessels constrictor, all the fluid where it needs to be. Another type of distributive shock you may see is anaphylactic or anaphylaxis, which is a severe life-threatening. And stridor. Stridor is up high in the airway. Stridor is an upper airway in the trees. Your lungs upside down look like trees if you think about it like that. You may have hypotension, which is low blood pressure that can develop fat on the 4 that we went over. Nope. I'll give it a second, see if anybody has any questions. Neurogenic, nature of the brain or spinal cord injury, usually a high spinal cord injury. Let's see here. They're not doing what they're supposed to. You could have hypotension with normal or slow pulse, warm, dry site. You can also have bradycardia, which means a slow heart rate. Instead of rapid, it is slow. Possible priapism. Some things you may see with neurogenic shock is bradycardia we mentioned, but you also may have a very high blood pressure too, if it's a brain injury itself. Bradycardia, and then the hypertension you may hear means it is hitting with you like a ton of bricks. It's very strong. Okay. Let's see here. High flow O2. One caveat for high flow O2 is to watch for the cardiogenic shock. We'll be careful with that. We'll get into that topic later on if you have questions about it. Okay, circulation. If there's any external life-threatening bleeding, direct pressure. I don't care if the limb is missing. You're going to put direct pressure on that and then get your tourniquet per registry standards. depending on your unit and local protocols. So you're gonna let's see here. Direct pressure for, if it's not honestly, if it's not gonna direct pressure is not working after like if you know it's gonna need a tourniquet, just put direct pressure while you get the tourniquet ready. While your partner gets the tourniquet. Patient supine on their back. Uh, this part right here with the legs slightly. Oop, here we go. Place them on the back supine or position of comfort unless contraindicated. Contraindicated means reasons not to do something. Preserve their body heat, keep them warm. I don't care if it's 100 degrees out. If they were in the shock, keep them warm. So put a blanket, warm them. Passively rewarm them means letting their body heat itself up with layers around it to keep the heat trapped. Nothing by mouth. PO means by mouth. NPO means nothing by mouth. And reassess every. If you need to do anything for the patient in GCLC, ABCD, consciousness, chief complaint, airway, breathing, circulation, specific stop, hemostatic dressing. Really, the only good area to pack it is around the inguinal area or around where the pelvis is. You can pack it there, or kind of right in the. We do not pack hemostatic dressings in the chest. It's gonna be ineffective. You ever push on your belly without flexing? It feels like jelly for me. It's gonna move around and go wherever it goes. So hemostatic dressing. After you place the hemostatic dressing, you pack it and hold pressure for 3 minutes, whatever one you want to use. If they're in anaphylactic shock, is with them, and you can administer it then. Cardiogenic shock. How do we treat this? O2 or sorry, manage their O2 levels if needed and transport them. Put them in the semi-Fowlers, make them comfy. Do not elevate the legs. You're trying to keep pressure away from the heart. Give them, if they, as long as they have no contraindications, you can give them the aspirin. 481 milligrams chewable aspirin, so that's 324 milligrams of chewable aspirin. Used to call baby aspirin, but they changed that name because you should not be giving aspirin to babies unless they absolutely need it, which is very rare. Okay, it's not good to give aspirin to babies. Don't do that. So you give them the 4 chewable aspirin, which makes the platelets slippery, so the platelets will not clot anymore. Blood pressure is up. It's above 100 per registry standards. Then you can assist with the patient's own prescribed non-expired nitroglycerin as long as their blood pressure systolic is above 100. They have not taken 3 of them already, and they have not had any sexual dysfunction medications in the past 48 to 72 hours. And neurogenic shock, C-spine precautions made to maintain C-spine stabilization. C collar is not C-spine stabilization. As a reminder not to move your freaking neck. Just because you put the C collar on does not mean you can let go of the neck when holding C-spine. Once they are strapped down in the head blocks and the strap as an EMT, our focus is early recognition. Figure out what type of shock it is. If you catch it in compensated shock, counteract it so it does not go into decompensated or okay. Airway, O2, bleeding control, warmth, and transport. Low BP is a late sign and reassess every 5 minutes. Every 5 minutes. Questions, comments, concerns, complaints, gripes. Bueller. Oh, I don't want that one on TikTok. There we go. Okay. You can also find me in Scarpino Life Support Training on all platforms. That's my more professional page without the humor. more professional without all the for what? What you got, Tina? For taking NREMT. Pull my face up a little bigger here. Oh, it's me. Passed class December and taken mid-February. Okay, it's a good time to study. Apps. It's practice taking tests. That's the best thing. Is it blurry to y'all? Uh, Limmer has a really good study app that I used initially. When I study, I don't study much. You talking about the LC Ready, like the pass on there? I can't say yay or nay for best apps because I've only used really two of them. Vibe Strawberry. I feel like my camera's blurry. Am I going crazy? Let's see. My blur. Oh yeah. I don't have good quality camera. My, personally, I love Tina, one of my medic or EMT friends, is saying, me personally, I love medic test practice exams and its feedback. Love Pocket Prep for daily studying. And whenever you are using an app, though, make sure it gives you feedback. Make sure it provides feedback for you. Yeah, Z and Limmer, I like his app. I met him in person a few times. Pretty cool dude. But make sure it has feedback. If you need to pay a little extra for that, do so. Practice taking tests. Timed with stress there for Tina, okay? And no, the amount of literally a horrible test taker would take the test and Pocket Prep are paid apps, yes, as well as some parts of LC Ready. So I believe if you get to have his book, I believe there's a code that comes with it for free. Discord already, Discord Medics After Dark. It's a pretty good group of people that help you out. Just ask questions in there as long as you're above the age of 18. Let's see here. Any other questions before I get ready to log off for the night? If you have Person Plus and still in your class, that gives you good practice questions to study for your unit exams. Oh, Pearson. Pearson Plus, okay. If you have Pearson Plus and it's still in your class, that gives you good practice questions to study for your unit exams. That's correct. A lot of people like to study for that. I have and have all my highlights in there still. I have everything broken down by section. I'm personally not a studier. I find it really hard to sit down and study. But if you make it a game or make it fun, where people can ask you questions and you answer it verbally, I feel like that's the best way to learn. I learn best when I teach. If you a library, coffee shop, or somewhere you can ask each other questions. I'll see if I can find any to post here. I have private Kahoots if anyone ever wants to study after you take it. Resolution. That's good there. FPS. No, it's already auto. Huh. might need to upgrade my camera soon. Out of the 4 in my district, I am the last left to take it. They all have passed. Hold up, let me try turning off the big light. Yeah. Absolutely. I have not seen the EMT exam since 20. You'll probably see more people doing these kind of streams, but specifically on Discord. There's a bunch of good people on the Discord over people are back to reality. Thank you for following the street, Booksmart EMT. Hello, and welcome, children. Shoot. Let's see. Y'all make sure to follow Brad. Yes, please. How's it going? Been teaching for, let's see here, almost a decade now. Been about 8 years of me teaching. I love it. Chicken. La 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 lesson. Medic. Brad's EMT lessons. Yeah, they're having a snack. I don't know what I'm saying. Oh, I'll probably end this soon. I got like, be sure to join the Discord down below. Medics After Dark. Maybe I have a lot of fun conversations in there. A lot of people